You've probably heard the phrase, nothing about us without us. The saying has a long history and continues to resonate with many different communities and movements who advocate for direct participation in decision-making that affects them. But did you know this also applies to healthcare research? And that research being carried out with or by members of the public rather than to or for them has clear evidence-based advantages? My name is Laura Ferreira-Legere, and I'm your guest host for today's episode exploring the power of research led by patients and the public.
You know, we're talking about knowledge, we're talking about evidence, and I think a lot of people are starting to recognize the fact that, my experience is knowledge and evidence. I know what I went through. I know what these people are going through. I can speak to that.
When it comes to health, there is so much content available now that completely blurs the line between fact and opinion. And it can be very difficult to be able to identify facts.
Welcome to In Our Voices, the podcast that takes you beyond the data to meet the people and hear the stories that help shape health and healthcare for all of us. ICES staff, scientists, and partners are on a mission to make healthcare better and people healthier. In this podcast, we share our stories in our voices. A note that the opinions expressed in this podcast don't necessarily reflect those of ICES.
Joining me today are past and present members of the ICES Public Advisory Council, also known as the PAC. Jenny Kirk was a PAC member on our second cohort from 2021 to 2024. Jemal Demeke is a current PAC member who joined the group in 2022 as part of our third cohort. Jenny, Jemal, welcome to In Our Voices.
Thank you, Laura.
Thank you. Hi.
So I'd love to start by having you tell me a bit about, why were you interested in joining a public advisory council? And maybe also what it means to you to be a public advisory council member. And maybe I'll start with you, Jemal, if you want to jump right in.
Sure. Yeah. So for myself, I feel, one, I've always had a passion for community advocacy, whether that was from the form of organizing marches to working in a human rights center. I always felt like there was a need to, interrogate the systems that, control how we live. And so I've always also had a passion for healthcare. And for a long time, I always thought that those two things were very separate, simply because I didn't have the exposure to understand how health equity is really become such a growing focus. And I've been, appreciating that. And as I became a researcher then and started to really interrogate the way that things like racism, homophobia, sexism are really integrated in the way that health service delivery happens, not just in our own province or country, but across the world, I took a step back and thought, there's some really great ways that I'm engaged in the work that I'm doing, right? Or even in the academic pursuits that I have. But I felt that I was a bit limited in the things that I could say there. But I'm still a person, right? I'm still a community member. I'm a person of the public, just like everyone else. I go to the grocery store. And so I have thoughts that I want to express. And that's honestly what, happened when I first saw the ICES Public Advisory announcement saying that they're looking for more people. I was like, this is great, because I also have a passion for data. And so that's why I joined. And, what it means to me is really just, again, as I said, an opportunity to be a human being. And that's what I feel like every time that I come into the meeting, that I don't feel the pressure to have to say anything. I can say what I want.
Mm-hmm. Yeah, I really appreciate that. And I think what always makes our meetings so interesting as well is that, everyone wears many different hats. People have different backgrounds, different perspectives that they're bringing to the table. And I think what makes it so authentic too is that, people come to the table exactly as you're saying, as who they are, and they're able to kind of bring those perspectives forward and the different experiences together.
Yeah, I completely agree with Jemal. It is a very welcoming and, inclusive group. For me, I heard about the PAC when I was driving home from my friend's place in Ottawa. A former member, I guess a member, he was on CBC radio, talking about this ICS and the PAC. And I thought, oh, this is interesting, because at that time I was looking for information to help me persuade the administration where I worked that the community that I worked with there was at greater risk, and I had zero to go on. And again, this was during the pandemic. And so I got home and I Googled it, and there was an article that was so persuasive and so useful for exactly what I needed at that time. And I thought, okay, these people, how can I help? What can I do? And so that winter, the little thing came up and said, join the pack. And I said, yes, please. I would love to join the pack. This is fantastic. And so, what does it mean to me? It gives me a glimpse into sort of what's going on at ICS, which is something I'd never heard of these guys before. And it's amazing for me. It's a free education about what's going on in terms of research. And it's such a great opportunity to provide feedback, when requested.
I've definitely noticed, there's a lot of passion for research now, and people want to get more involved. They want to better understand it. And I'm just wondering if you had thoughts on that, thoughts on why the public, maybe now more than ever, really wants to get involved in research and understand it, and just dive deeper into that world.
Well, I think, quality research is useful because it presents reality, right? It's facts, or it's on the way to facts. And I think, especially for the people of Ontario, it's such a great resource to be able to have access to the reality. We can have this opportunity to have some participation with our own data. And I think that is, if there's an opportunity to get engaged, I think people will get engaged and they will get interest.
I'm going to build on that, in that I feel that there's a general interest in activism, in speaking your voice. People want to assert their autonomy or their independence. And what better space to engage that in than health, right? That's something that we all share, our bodies that we care about and that we need to nurture and that we need people to take care of, right? In this health system. And so without an understanding of what's going on in the health system, people feel like they don't understand what's going on for themselves. And also realizing the lack of information for certain communities over others, right? That a lot of the research does not focus on perhaps what Black populations are going through or rural communities. And so needing to put a spotlight on that. And so what this space then allows is just, again, an outlet, right? To bring that energy, bring those fears from the world, bring that desire to, really be in control of who you are and make sure that the voices for the people that you care about are included.
Yeah, absolutely. When it comes to health, there is so much content available now that completely blurs the line between fact and opinion. And it can be very difficult to be able to identify facts. And so, if people are becoming more interested in health, it can come from sort of a place of misinformation or a place of information. And so it's great that ICS is stepping into this space to, more and more provide information that's accurate.
Yeah, I really like what you just said. And it makes me even think about how health and healthcare has been politicized, right? And that's been something that we've all seen through the pandemic, how vaccines, which, for the most part before was pretty standard in the way that we thought about it, but then now represented, so many larger issues, some which I think are important issues that we do need to address, right? Around colonial legacies, around, how healthcare and medical interventions have been developed. That is something that we do need to address. And that's the, positive side of politicizing, healthcare, because it's always been political. It always has. And now we're recognizing it. There's also the other side, though, right, of people who are using health and healthcare as a way to weaponize that mistrust to get people to disengage even more, right? And cause those divisions so that people completely remove themselves from accessing services. Because although people have great reasons for not trusting, medical professionals, at the end of the day, as I said, we do need healthcare, right? We do all have bodies at the end of the day.
It's a good segue in, because another thing I was thinking about was in a project we're going to talk about shortly, one of my favorite quotes in this work that we did together with the PAC, which I'll read, is, We realized early in the project that the goal was not to turn the public into scientists and not to turn scientists in the public. Just wondering if you had thoughts on, what does that mean to you? And then also, is there other ways we can think of how public or patient and scientific knowledge can complement each other?
Yeah, well, what I sort of experienced while working on the PAC is the researchers who are pure researchers, I think, may not realize the level of scientific literacy sort of in the general public. And the general public includes people like politicians and journalists. And so I think sometimes, like, I agree, you don't need to, the public doesn't need to become a scientist, and the scientist doesn't need to become the public. But I think often it's easy when you're extremely educated to lose sight of how educated you are. Like, you don't recognize what the tremendous scientific literacy gap that exists between where you are and where the public is. And I think that when it comes to, I think it could provide a useful reality check for people who are, quite researchy. I think that people who are primary physicians, interact with the public all the time and probably tend to sort of get a sense of what people know and what people may not know. Because, there's not a way that someone like me could just walk into ICS and make meaning of all of the data.
But what we always try to explain is that, including engagement or including the public or patients or communities in the work you're doing doesn't discredit what you already know. In fact, building on it, it just allows you to see a different piece of the picture that you maybe didn't see before. And I think that's part of why the work of the PAC has been so important is, it's kind of socializing this idea that, there's a lot of expertise that comes from patients in the public, and it's not taking away from the scientific body of knowledge.
We're talking about knowledge, we're talking about evidence, and I think a lot of people are starting to recognize the fact that, my experience is knowledge and evidence. I know what I went through. I know what these people are going through. I can speak to that.
I was wondering what you both think about how we can make good quality research more accessible. There's a lot of misinformation out there. There's a lot of just overwhelming data coming at folks every day. And I'm wondering, how do we get good research in the hands of the public in a way that's more accessible?
This is a big question, right? And it's hard to encapsulate all the things. But one thing I'm thinking about myself during the pandemic when vaccines, first started coming out is I think one thing that helped is just recognizing and empathizing people's pain points. I think that was the main thing. And even in saying, I'm not trying to convince you of anything here necessarily. You're welcome to continue to think what you want to think, believe what you want to believe. But here is just some information that I have that drew me to my conclusions. No one wants to be chastised or talked to. And I feel that's often how it feels. So again, it's about breaking it all down, bringing it to a human level and just saying, hey, I'm trying to help. Here's something for you to know. And, we can have a conversation and go from there.
I agree that if you come at people from a position of authority or superiority, you're more likely to dig people in, right? They're going to dig in on their perspective. And it's never been easier to make a video. You can find whatever you want to support whatever your perspective is. And so I think that sort of the period of authority is kind of behind us. It's not sustainable and it's inhumane.
And I think, again, if we can come back a little bit, because I know we talked earlier about some of the mistrust in data and we were talking about misinformation and all of that. And I kind of want to just come back and say, do you think that the work of public advisory councils and the public and patients being more involved in research like this, can that help to rebuild trust, or does that contribute? Or do you think we need to take it steps further?
I don't want to put it as an either or. I feel like we could all strive to do more, but I don't want to also downplay the significance of what we've already achieved together and what we've done. There's kind of exponential level of change that we can think about. By involving one person into the process who understands what's going on, we have now equipped or enabled them to have conversations with everyone else that they're meeting, right? And talking to.
Yeah, no, I agree.
Thinking about the project that we did as a public advisory council at ICS, where we actually, from the onset, we explored a topic, then we got into the results, we determined what kind of products we wanted to put out there. And I do want to talk a little bit about that project because I think it feeds into a lot of what we've been chatting about. And, around the time when we started to think about doing this, and it was a request that came from the group as a collective voice, like, we want to be involved in a project that actually kind of dives deeper into this. And ultimately, we landed on mental health. Where we ended up landing as a group was really exploring those social factors. So, do things like income influence where people are going for mental health care, things like neighborhood, like housing situation, and many different kind of social related factors. And so when we kind of completed our analysis and finished looking at everything, I would say the results probably reinforced what a lot of the group knew from lived experience, which again, just kind of speaks to that expertise, like the science going hand in hand with the public experience. Did you have any initial reactions or thoughts, or really kind of what did you take away from seeing these results?
As you said, it really just reinforced, I feel, what myself and a lot of other people I'm sure already knew when it came to housing being very important for your mental health.
I realized it completely reflects my own experience. My younger brother struggled with early psychosis and addiction issues. And I'm not, spilling his tea here, like he's passed away. And so it's, there's not a privacy concern. He doesn't have family, but we were always in the ER. We were always in the ER. Like either he thinks he's having a heart attack from the substance abuse, or, he thinks that it's urgent to get, a brown coat rack with 5 prongs. Like we struggled from like the year 2000 to the year 2004 to get him help. You can't self-refer to many early psychosis, or at that time you couldn't self-refer. So where do you go? To the ER. Will he come with me to other places? No, he will not. He was about to be homeless, and there just wasn't, that wasn't an option. And so, we talked to my mom and, cobbled together the $40,000 it cost to do it privately. And the results in the research don't show all of the private activities that go on, right? That your people are paying for out of pocket and are only available for privately, that are necessary, but private. And so it struck me this week, like, yeah, no, I've lived this and I kind of didn't realize it.
Thank you, Jenny, for sharing that also, because, we sometimes forget when we are just presented with this data and we see a graph and we think, oh yeah, I see the trends, I see what's going on. But you forget that each of those data points is a person, a real experience of somebody that has gone through the system, and it's just not always reflected. And again, I think it just comes back to this whole conversation and talking about the power of, working with the public and just kind of understanding or peeling back a little bit of those layers of what's really going on behind that graph.
It's obviously such a problem or a concern that has touched so many of us in the pack. I mean, I think that's why we picked it, right? Like it's something that everybody can relate to, sadly. And so, yeah, I mean, among our group, among our family, among our friends, in our communities, this is a big problem. And that's why we prioritized this as, our question, because we want action. We want change.
I suppose just a prioritization at the very least, right? That all of this, like research builds onto each other, right? That's the point of it. And I feel like there's enough that we have built onto. I think this is the piece we need. We're always talking about the lack of data here to prove our points as to what our experiences are. What we need now is this to reach that higher level of, okay, this is now a priority that everyone has to create some type of strategic planning around.
Yeah, I agree. And seeing my brother struggle with housing 100% due to mental health and addictions concerns, we have a lot of folks who are unhoused. And we're just, at best, ping-ponging them in and out of the ER, back into the street. And then, there needs to be something more where people have some place to go or some support beyond what we're doing right now.
Is there anything that you would want other patients or the public to know if they're interested in being involved in research or interested in getting into a public advisory council?
It's really just you coming in as you are and who you are to learn more and engage more. And it stops there. And who knows, as you learn more, your mind may change.
I totally agree. If you are interested in health or health concerns or the healthcare system, this is a good place for you to just come and see for yourself if you are at all interested.
Thank you, Jemal and Jenny, for joining us today and sharing your perspectives and really helping to shine a light on the importance of meaningful public and patient engagement in research.
Oh, yeah. Thank you, Laura and ICS. It's been great being here.
Yeah. Thank you so much, Laura and Jemal. It was a pleasure.
Thanks for joining me for this episode of In Our Voices. Please be sure to follow and rate us on your favorite podcast app. If you have feedback or questions about anything you've heard on In Our Voices, please email us at communications@ices.on.ca, and we'll be sure to get back to you. We might even share your feedback on a future episode. I'm Misty Pratt, and wishing you strong data and good health.